continuation of different kinds of anxiety disorders. Again, this is Donna Lea Buendia, and I am going to continue our lecture. PTSD or post-traumatic stress disorder. So this is actually based from the name itself, post-traumatic. It is actually, the source is a trauma. Okay, the patient may have experienced an event or witnessed it or have been confronted with an event that involved actual or threatened death or serious injury. So if the person has PTSD, the response are intense fear, helplessness, or horror. So the patient having the symptoms might experience it for 1 to 3 months, and this is categorized as acute. If the patient has the chronic PTSD, it might last for 3 to 6 months or more than that. Okay? And the cause of this disorder are classified into natural or man-made. So when you say natural, it could be an earthquake, it could be volcanic eruption, could be typhoon. When you say man-made, it could be rape, torture, hazing, or harassment. Okay? And PTSD could happen in one individual or more among group. So the symptoms of PTSD includes re-experiencing the event, or there might be some flashback of the event. There are recurrent dreams of the event. So these are not just ordinary dreams. Sometimes those are repeated flashback, or could be a nightmare or a night terror associated with the trauma. There will be a sudden acting or feeling as if traumatic event was recurring. And these are like reliving the experience. There might be illusions and hallucinations. There is also a persistent avoidance of a stimuli associated with the trauma and persistent symptoms of increased arousal, for example, difficulty to sleep, irritability, and concentration. So these are the treatments for PTSD. You have cognitive therapy, exposure therapy, eye movement desensitization and reprocessing, or EMDR, and then we can have also medications. So in cognitive therapy, this is talk therapy, wherein you're going to ask the patient to tell you about the source of trauma. So this is very complicated. And the psychotherapists who should do this must be well equipped and an expert in this kind of things, because it was like you're going to reopen an almost healed wound, and the patient will experience again the pain. Okay, and if you are not expert in that field and you are not well equipped with how you handle it, then that wound might left open again. Okay, so your task is to close it so the patient will permanently heal. Okay, then you have exposure therapy. The good thing about exposure therapy is we can use technology here. Okay, like for example, we can use virtual reality programs wherein you're going to expose the patient by using a software. For example, the patient is a soldier, is an ex-soldier or an ex-army, so you can have the virtual program just like a battlefield, but you need to make sure that the patient is feeling safe, because it is only reenactment of the event before, and he is safe because it is being conducted inside your clinic. And from that activity, they will learn how to handle those kind of situations in a more safe manner. Okay? Then we have EMDR, or eye movement desensitization and reprocessing. So this combines exposure therapy and guided eye movements that help the patient to process traumatic memories and change how to react on them. Okay? They can also use medication, anti-anxiety and anti-depression medication, which can relieve the symptoms of depression and anxiety. And good thing is it can also help to improve sleep problems and concentration. Alright, so let us proceed with the third type of anxiety disorder. This is generalized anxiety disorder, or GAD. So, if you know a person who worry a lot, okay, these are worrisome people who worry a lot, and even though it's not their problem, they considered it as their problem. So, the symptoms are restlessness, easily to be fatigued, irritability, difficulties in concentration, muscle tension, sleep disturbances. So actually, it may start commonly among 20s and 30s. Why? Because this is the adulthood stage wherein the person might have more responsibility financially, emotionally, psychologically, and physically. Okay? So this might be chronic or might continue for life if the treatment could be unsuccessful, if there is no treatment at all. And one of the complication is panic attack. The other people who have this kind of disorder could also divert into addiction because they considered it as a self-treatment. But as I have said in the first video, this is not a good coping mechanism because it is a complication. So the treatments for GAD includes drugs, okay? Not the illicit drug or illegal drugs, but these are actually prescribed to avoid or to control anxiety. They can also use psychotherapy, or for example, psychoanalytic psychotherapy, wherein they are going to trace what did happen in the childhood that might cause general anxiety disorder, so they can resolve that issue. And then behavioral psychotherapy, wherein they can use different kinds of behavior modification technique for them to relax and for them to desensitize these kinds of negative behavior. Next, we have OCD, or Obsessive Compulsive Disorder. So, OCD has two components, obsession and compulsion. When you say obsession, these are unwanted or undesirable thoughts or idea that come into our mind that is really hard to dismiss or to erase. Okay? When you say compulsion, these are repeated behavior or performance of an act, or it could be a ritual, which is contrary to the wish of the patient, but still he cannot control himself and he still do it. Okay? Now, if you're going to combine obsession and compulsion, then we have obsession compulsion, wherein the patient will continue to repeat the rituals for him to relieve the anxiety of obsession. Okay? Let's say, for example, you have an obsession with cleanliness. So the compulsion is repeated washing of hands 20 times, 100 times, or even more. Okay, just for you to relieve the anxiety that you're feeling towards being too much clean, and that is your obsession. Okay? The patient tried his best to resist, but because of long period of disorder, resistance might decrease. Right? As a result, patient will have much difficulties in social relationships. All right. So prognosis. Actually, patient may not present this to psychiatrists for 5 to 10 years because they thought that it was just normal for them to be too much clean, too much perfect, too much orderliness. Okay, but 30% of those who have treatments have good improvement. 30 to 40% mild improvement, and the rest, okay, they become worse, or it might become chronic, or others might become a lifetime disorder. Okay, some patients may have experienced also depression and suicide or addiction. Okay, so what are the treatments for this? So we have drugs or medication, which is called anfenil or clomipramine. So this is for 6 to 12 months for those who experience this for 6 to 12 months. Then we also have behavioral therapy, which is found to be effective for 60 to 70% among the patient. So we have different techniques used in the therapy. We have desensitization, and they are taught how to stop their thought or flooding and implosion therapy, wherein they are going to be taught on how to avoid this kind of obsessions. There is also a technique called aversive conditioning, wherein they are being exposed to punishment or painful shock or loud noise whenever there is an obsession or a thought that occurs into their mind. And then we have the psychodynamic or psychoanalytic therapy, wherein the therapist will strengthen the ego of the patient to deal with the aggression in more mature way. Okay, next we have panic disorder. So panic disorder includes panic attack. This panic attack is like heart attack, okay? Wherein the patient experience palpitations, sweating, trembling, shaking, sensations of shortness of breath, chest pain or discomfort, nausea, feeling of dizzy, fear of dying, chills, or hot flashes. That's the reason why it's more like they're having a heart attack and they are afraid that they might die in that kind of situation. Panic attacks has no cue. It is unpredictable. It just happened all of a sudden. Okay. So what are the treatments for panic disorder? We have the CBT. Okay. So actually, it is also effective in treating agoraphobia, and of course, panic attacks or panic disorder. So they are being thought of thinking patterns on how to sustain the triggering of the panic attacks. In exposure therapy, so they are given an opportunity to learn healthier ways of coping with their panic. And then we have also medication, which is antidepressant or benzodiazepines. In antidepressant, this must be taken continuously because it will take several weeks before it work. Okay. While for emergency cases, you can use benzodiazepines, wherein after 30 minutes, the symptoms of the panic will disappear. Okay, thank you very much for listening in my slide. Okay, if you have any question, you can feel free to contact me in my email address, psicologista.files@gmail.com. Thank you.